Hello everyone, nice to see you again. Today we will discuss about Ehlers Danlos syndrome. It has many types and all these diseases are caused by mutations in that type of genes that encode structural proteins. So this syndrome is also simply we can say that this is the EDS syndrome, and which is connective tissue disease that affects about 1 in 5,000 people, which is characterized by defects in collagen production. This syndrome is named after two dermatologists. First one was Danish Edward Ehlers, and second was the French dermatologist, which was the Henry Alexander Danlos, who described it first. All are single gene disorders, but they may be transmitted both by autosomal dominant and some are transmitted through a recessive pattern. So if we simply talk about first about inheritance, there are two main types by which this EDS syndrome can be inherited. First one is autosomal dominant inheritance, hypermobile, classical, and vascular type of the EDS, which they are transmitted through autosomal dominant type of inheritance. And the faulty gene that causes EDS is passed on by one parent, and there is a 50% risk of each their the children developing this condition. Autosomal recessive inheritance, Kyphoscoliotic type of the EDS shows this type of inheritance, and faulty gene is inherited from both parents, and there is a 25% risk of each of their children developing the condition. A person with EDS can only pass on same type of EDS to their children. For example, if a person is suffering from a hypermobile EDS, he can only inherit this hypermobile EDS to their children. He cannot inherit vascular type of EDS, and the severity of condition can vary within the same family. Types and groups of EDS syndrome. Here we can see different groups of pictures. Here we can see normal collagen fibers, or they are of normal uniform size and they have the proper spacing, and fibrils from a person with dermatosparaxis. And here we can see shows dramatic alternations in fibril morphology with severe effects on tensile strength of connective tissues. For example, person with classical type of EDS shows this type of. And here we can see shows composite fibrils from a TNX deficient person. Here we can see they are usually uniform in size, but here we cannot see any composite fibrils. And for example, it is TNX null condition, and here we can see fibrils are less densely packed and they are not aligned with neighboring fibrils. TNX is actually a member of extracellular matrix glycoprotein, belongs to the tenascin family, and TNX deficiency often leads to Ehlers Danlos syndrome. There are about 13 types of EDS, most of which are very rare, which includes classic-like, cardiac, valvular, vascular, hypermobile, arthrochalasia, dermatosparaxis, kyphoscoliotic, brittle cornea, spondylodysplastic, musculocontractural, myopathic, and periodontal. Each type of EDS affects different areas of the body, but they have only one thing in common, which is hypermobility. Hypermobility, which is unusual large range of movements in joints, like you can move your thumb and fingers more, they can more bend. And syndromes can also be grouped by symptoms determined by specific gene mutations. For example, group 1 disorders are those which affect primary collagen structure and processing. Group B disorders affect collagen folding and cross-linking. Group C are disorders of structure and function of myomatrix. Group D disorders are those that affect glycosaminoglycan biosynthesis. Group E disorders are characterized by defects in complement pathway. Group F are disorders of intracellular processes, and Group G is considered to be unresolved form of EDS. What are most common types? In this case, most common types include hypermobile EDS, which comes in categories type 3, which is mainly characterized by hypermobility that affects both small and large joints. In people with this variant have skin that is soft, smooth, and velvety, and mothers may feel the difficulty taking care of with their baby because of dropping of baby due to the weak connective tissues in arms and legs, falling and healing from birthing processes. What are features of this type of variant disease? They can pull little finger beyond 90 degree. They can pull thumb back to touch forearm. They may have loose, unstable joints that dislocate easily. Extreme tiredness, digestive problems such as heartburn and constipation, dizziness and increased heart rate after standing up, problems with internal organs such as mitral valve prolapse or organ prolapse, and they may suffer from the bladder control. And their next is classical EDS, but this is less common than hypermobile EDS, and this tends to affect the skin more. This comes in category type 1, which is characterized by extremely elastic skin that is fragile and bruises easily, and hypermobility of joints. They have fragile skin that can split easily, especially over the forehead, knees, shins, and elbows. They have the smooth velvety skin that bruises easily, and wounds that are slow to heal and leave white scars. Here we can see elasticity of the skin, and this is the hypermobility. What are rare types? Vascular EDS. This is a rare type of EDS since it is often considered to be the most serious. Common symptoms include thin, translucent skin, easily bruising, characteristic facial appearance, fragile arteries, muscles, and internal organs. Vascular EDS is caused by mutations in COL3A1 gene. Rarely, it may be caused by mutation in COL1A1 gene. Inheritance is autosomally dominant. Treatment and management is focused on preventing serious complications and relieving signs and symptoms. Kyphoscoliotic EDS. This is rare, and kyphoscoliotic EDS is associated with severe hypotonia at birth, delayed motor development, and progressive kyphoscoliosis. Kyphoscoliosis, here we can see there is a curvature of a spine, and which condition is known as the kyphoscoliosis and scalar fragility. Kyphoscoliosis EDS is caused by changes in PLOD1 gene or FKBP14 gene. It is inherited in autosomal recessive manner, and treatment is same, is preventing serious complications and relieving associated signs and symptoms. If we talk about overall treatment for Ehlers Danlos syndrome, and there is no any specific treatment for EDS, but it is possible to manage many of symptoms with support and advice. People with EDS may also benefit from support from a number of different healthcare professionals. For example, a psychotherapist can teach you exercise to help to strengthen your joints, avoid injuries, and manage pain. If you go to occupational therapist, they can help you manage daily activities and give advice on equipment that may help you. And counseling and cognitive behavioral therapist may be useful if you are struggling to cope with long-term pain. And for certain types of EDS, regular scans carried out in hospital can detect problems with your internal organs, and genetic counseling can help you learn more about causes of your conditions and what are the risks of passing it on to your children and how it is transmitted, they can tell you. And that's all for today, and thank you for watching my video. And if you like this video, hit that subscribe button. If you want to see me cover any other topic, leave a comment below. Thank you very much.